Okay, so many people believe heart disease is mainly a man's issue. Well, ladies, listen up. That is a myth. In this week's Women's Care Wednesday, Dr. Anjum Kumkarni of Women's Care of Florida is here to discuss why we need to be serious and educate women about signs and symptoms of cardiovascular disease. Good morning, doctor. So good to see you.
Thank you so much for having me here, and it's a good time to be here with the American Heart Association Heart Month.
Yeah.
And, it is absolutely, I totally agree with you. It is a big myth that women are not at as much risk for heart disease.
I don't know why we think that, because the numbers don't show that.
Yes, so the numbers don't show that. Basically, women are as much prone to heart disease as men, and it is actually the #1 killer in women also. So is it in men, but women also, it's the #1 killer. And every year about 400,000 women actually die from heart disease. It's sad and unfortunate, but we're going to talk a little bit about risks so we can prevent it.
Because that's why my next question, it is preventable in a lot of these cases. So what is the main message you want to get as far as being preventable? What do we need to know? What do we need to do, doctor?
So we need to realize and educate women about what the symptoms of heart disease, the symptoms and signs, because most of the times what I've seen in my patients is that women tend to downplay the heart symptoms. They chalk it out to less threatening conditions. But
what are some of the more common ones for women?
For women. So the commonest symptom for heart attack is chest pain, like the typical dramatic when we see chest, hand on the chest, shortness of breath, and pain getting worse with exertion and stress. So that's the commonest symptom even in women.
Okay.
So if something like that happens, definitely take an aspirin and call 911.
Okay.
But in women, the interesting thing is that some of the symptoms are what we call atypical symptoms, because in women, there are smaller blood vessels also which can get blocked. So sometimes women can feel just a pressure in the chest. They can have shortness of breath. They can feel that they've run a marathon when they're just sitting. They can have pain in the back,
So is that when you need to go ahead and contact your doctor, and that's where it becomes preventable of saying something just doesn't feel right, I need to get this checked out?
Yes, definitely. So when women start having symptoms, of course that, but even before that, so women who are at risk of having heart disease, so women who have high blood pressure, high cholesterol, like high LDL, which is the bad cholesterol, low HDL, high triglycerides, women who have family history of heart disease, and inactivity, and also smoking.
Yeah.
So women who have risk of heart disease, they should definitely, if they start having some of these atypical symptoms, they should contact their doctors.
And you say women that are either just about to approach menopause or maybe just getting out of it, that is really a time in particular where you need to kind of watch out for these things.
Yes, definitely, because the risk for heart disease keeps going up with every year for men and for women. But in women, there is a big jump right after menopause, because what happens is that estrogen, the naturally produced estrogen in our body, has some protective effect for our heart and the blood vessels. It keeps the blood vessels very flexible. So what happens after menopause is that the natural estrogen goes down, and then also an interesting thing is that the other risk factors go up. So the blood pressure starts going up, the cholesterol starts going up, so blood pressure creates this shearing effect, and the plaque starts building up, and they are at higher risk.
As we close here, I know you wanted to bring up the importance of meditation, and that's very important for you as far as stress relief and anxiety and maybe trying to get rid of those things. Why is that important? What do you suggest women do?
So stress is one of the very big risk factors for heart disease these days, especially that's, I think, one of the reasons why we are seeing heart disease earlier on. Like usually it used to be a disease after the age of 50, but now we are seeing it earlier on also. And American Heart Association came out with a statement last year that doing meditation may help reduce the risk for heart disease.
So you literally say, like, sit still.
So you sit still, bring your intent to your heart, and say in your mind, may I be happy, may I be at peace, and may I be free from worries. And this actually has been shown at Harvard to reduce the risk of heart disease and increase the heart function.
Well, I wish we had more time, doctor. I just love you. Thank you so much for coming in this morning.
Thank you.
It's so important to get the message out this time of year and the rest of the year as well.
Yes,
so
definitely.
We hope to chat with you again.
Thank you.
And of course, if you have any questions, there is the information on the screen. You can call there or go to their website as well.
Business.